Welcome. My name is Corinne Waldow. I'm the Economic Development Director for the Boulder Chamber. I want to thank you for joining us this week for the Personal Services, Limited Healthcare, and Retail Call. I hope everyone had a safe and healthy 4th of July, and we appreciate you continuing to tune in to learn about the best practices and how to open safely, the requirements you need to follow, and how we as a community can move us forward in opening more businesses and keeping everybody safe. At this time, I'm going to hand it off to Jesse Rounds with Boulder County Public Health, but anywhere along the course you need a question answered, please put it in the chat or Q&A.
Thanks, Corinne. Again, I'm Jesse Rounds. I'm with Boulder Public Health, and I'll be doing the introduction here in a couple of the subject areas. So just to start, I'm going to go over public health order updates, a little epidemiological update, go into what the future of public health order looks like, and then we'll jump into the sector specific information. The big news in terms of the timeline doesn't directly affect Boulder County and the residents of Boulder County at the moment, but that is that yesterday the state began accepting applications for the Protect Our Neighbors framework, which I will get into in a little bit. In terms of where we are with coronavirus and what's the long-term outlook, we're going to be under some form of public health order for quite some time. And that is because we do not have a vaccine, we don't have a successful or a for sure treatment yet, and we don't have herd immunity. So we need to recognize that the virus is still just as contagious as it was in February, and that it can, with a few small changes in behavior, it could end up overwhelming our hospitals and our healthcare system. So that's why these public health orders are in place. It's also why the face covering order is in place in Boulder County. I put this text here. It's a lot of text. It's kind of a wall, but it was included in the press release that came out when the Director of Public Health expanded or extended the face covering order for Boulder County indefinitely. And I think it's really important to note why we're doing this. And it really has to do with changing behavior, protecting those most vulnerable communities in our community, and also reinforcing positive behaviors like maintaining physical distance from from other people outdoors, but also remembering that when you are indoors, you should be wearing a mask, except in your own house. So as I said, the face covering order has been extended indefinitely. I also urge you, if your business is within a municipality, to check to make sure that there is or is not a local face covering ordinance, because that will impact how you operate. And then the last thing on this slide here is the face covering script that was developed internally, and it was in answer to a question that we were getting a lot, which was from business owners saying, I'm having customers come to me and say, I don't want to wear a face mask, but I want to shop. How can I deal with that? And so we go over some alternatives for how to communicate alternatives for shopping, such as curbside pickup or online ordering or that sort of thing. And it's just a helpful primer for how to get through that conversation. And this is just a little graphic that comes from the state website that I think is really helpful for understanding sort of the levels of risk that we take on when we decide to do something, and why we have the face covering order, why we have the public health orders, because what we're trying to do is control risk at various levels to try and make the choices that we all want to make to go and patronize businesses and go out and enjoy Colorado, try to make those as safe as possible. But we do have to recognize that anytime we go out of our house, anytime we do anything, we're taking on some risk as we go out there. In terms of sources of information, resources, these are the same resources we've been hitting for weeks and weeks. Our website, boco.org/COVID-19 business, has a lot of great information. We've started to point more and more to the state, but we do have a lot of in-house generated material like that face covering script, like some graphics that you'll see later in the presentation. COVID-19.colorado.gov is the state's website. It has access to both the actual original official public health orders, as well as their interpretation of what those public health orders mean. And it goes into sector by sector detail, so I really recommend checking it out. The other sources of information we have here are maybe sector specific, maybe industry specific. But they're really helpful for particular types of business. Licensing agencies right down there, particularly important for personal services and limited healthcare, which we'll get into in a little bit. Just a little bit about where we are in the public health orders. We just got at the end of June, the 8th revised order for safer at home. And it made changes for bars, closed bars that don't have food service, opened libraries, and opened open houses for real estate, as long as they follow indoor event guidance. And there were some other small changes that impacted various industries. And the safer at home guidance and public health order will remain in effect as long as Protect Our Neighbors is around. It's sort of the fallback. And any community that can't get to Protect Our Neighbors will have to stay in safer at home. And whether we'll see additional revisions is really up to the state trying to address any inconsistencies that do exist in the orders. Just a little bit about where we are in terms of our community and COVID-19 infections. We saw a spike in the middle of June, and we have successfully seen that drop off. However, there have been continued small outbreaks throughout the community at businesses. So we're still trying to work through social distancing, through mask wearing, through these behaviors that we're trying to reinforce in these orders to get down to a level where we can safely go to Protect Our Neighbors, which is the next public health order phase that the state of Colorado put out. The next phase is application-based. Each community, which in our case is the county, has to apply to join Protect Our Neighbors. And to join, you have to have a series of public health metrics met, that things like the number of new cases, the hospitalization rate, the mortality rate, they need to be all need to be low over an extended period of time. In addition, we have to produce a document that shows the state that we are prepared if we see a spike to back out of Protect Our Neighbors so that we can effectively and quickly address spikes in infection rates. We are not there yet. We're going to stay in safer at home until our numbers get down to the level where we can apply. Our public health team is constantly tracking that and trying to get to the point where we know right away when we're there so we can apply. And we expect that the application process, once we're there, would be about 2 weeks. So I would expect the earliest would be the end of July, beginning of August, before we could enter Protect Our Neighbors. And with that, I'll hand it over to Ambra.
Thank you, Jesse. So I am going to be giving some retail updates today, and just over the last week or two, we have had a lot of complaints regarding masks in retail establishments. So I just wanted to briefly cover some mask face covering information and regarding, where we're at as far as employees requirements, and then where we're at with customers, and then also just some of the cities that Jesse mentioned where there might be some varying differences. So basically, face covering requirements for employees, it's basically, limited healthcare, personal services, retail, personal training, and limited healthcare. They are required in all of those areas in all of the cities. And then where there are some differences for public and customers, if you look to the graph on the right, you can see statewide, they're required in critical medical and dental procedures, limited healthcare, personal services, and then in retail, it's recommended. And then anywhere in Boulder County, you can see that outdoors, and then children ages 3 to 12, it is recommended, and everywhere else it's required. Retail, they also say whenever social distancing cannot be maintained, which is typically in any retail establishment, maintaining that 6-foot distance. So thinking, people are passing in aisleways and things like that. So it's almost impossible to maintain that 6-foot distancing. And then just looking at the cities of Boulder, Louisville, and Superior, those masks are required in all establishments, indoors and outdoors. And then City of Lafayette, it's just children that it's recommended, required for everywhere else. And then also in the town of Erie, outdoor, and then children's age 3 to 12 outdoor. It's recommended, but everywhere else it is required. So just wanted to briefly cover that. As I mentioned, that is the bulk of the complaints that we have been coming in. And then Jesse, if you run to the next slide, just cover a little bit more on mask and face covering. So basically, with in public mask requirements, so, using verbal and signage reminders. So using the announcements over the store PA, just reminding about 6-foot distancing, and then also wearing masks. And then, as Jesse mentioned, the face covering orders have been extended. And he also mentioned the employee script to help, address that with your employees on how they can talk to people about mask usage. And then, one of the major exceptions has been medical reasons. And, in some cases, I know the city of Boulder, you have to have a doctor's note, but most of the time, if you just say that you have a medical reason for not wearing a mask, then in the rest of the county, that's what the requirement is. Thanks, Jesse.
I was muted, sorry. I just wanted to jump over to personal services and limited healthcare highlights. There really have not been any changes in the guidance for these sectors, save one thing that I will get into in a moment. But I just wanted to remind everyone that masks must be worn at all times when you're inside these businesses. The occupancy limits are 50% of the occupancy for that space. And you do need to pursue symptom and temperature checks. And I think the big change that I wanted to get to was that in the past, both for personal services and limited healthcare, there were no situations where procedures that required removal of a mask were allowed. And this most recent update now allows procedures without a mask to be performed as long as the practitioner is wearing their own face mask and a face shield. And the face shields need to be cleaned between each use. That's on top of all of the other guidance about cleaning the spaces you do procedures in. I think that the industry-specific guidance, as I say here on the slide, is available on the Department of Regulatory Agency's website. But a key difference for personal services versus limited healthcare: in personal services, the mask that the employee wears does not need to be medical grade. In limited healthcare, the mask needs to be medical grade. That is really the big difference for these sorts of procedures. And really, with that, we're happy to take questions. But before we get there, I just want to highlight We're continuing to hold these sessions. We want to try to help you open safely and continue to operate safely. So we're here to answer your questions. And if you're uncomfortable asking the question now, or a question comes up after this session, you can email us, or if you have a concern or comment about a particular business, please don't hesitate to call our call center. And just a note, as of yesterday, the hours for the call center are 9 to 2 as opposed to 9 to 5. With that, happy to take questions.
Thank you, Jesse and Ambra. That was very concise. I think this is the one section that doesn't have many changes this week. But with that, our questions are, how long will we be doing some of our current practices? For example, how long do you think retail will be doing employee health screenings, or personal services doing it, or client screenings?
It's, I mean, I get the right answer, the politic answer is we don't know. Until we have a way to protect the community against COVID-19, and we want to keep businesses open, we need to be implementing these tools to protect the community and our employees. So I would expect months and months of these measures, and very few tweaks because they are effective at screening.
Okay, so so employee health screenings, even in Protect Our Neighbors, will continue to be a practice among all businesses. Protect Our Neighbors just changes the capacity limits of some of the places.
So we actually don't know what Protect Our Neighbors does, except for that broad point that Protect Our Neighbors is promised to expand the maximum number you can fit as long as you can socially distance in your establishment. Beyond that, we don't know much, but our understanding is that Protect Our Neighbors is essentially safer at home with more people.
Okay, and especially as we enter flu season, I know there's a lot of talk that with flu season and the fall, that the health screenings is one of the ways to continually remind ourselves, if someone's sick, stay home, make sure that we don't have people sick coming into any place or establishment, correct?
Yep, exactly.
All right, so besides mask orders, do any of the local municipalities have any different policies to follow?
No. The cities have generally, they're following the public health order, which is so the Boulder Public Health has agreed to follow the state's public health order. The only way we can do anything is to be stricter than the state. And the communities can also be stricter than the county. But as far as I know, I don't know, other than mask orders, any specific items that are stricter than.
Which is why we put together that mask order guide to show you which cities. That is available on your website. It's available on our website. And actually, to get information on mask orders, for example, in Lafayette, you would go to the Lafayette municipality website to get their specific information, or Louisville or Erie, about mask orders. But in general, the only changes they're making to the orders that Boulder County Public Health is following, which are the state orders, are the masks.
Yep.
Do employees in limited healthcare settings have to wear masks in their back office where there's no patients?
So if they are near any other employee, yes. That is so. This is the interesting thing about all these businesses. You have a number of different business types, business environments within your space. When you're back in the back office, away from patients, you're in an office setting. And in an office setting, if you can't maintain 6 feet of distance from your coworkers, you need to be wearing a mask. If, however, you do have a closed office, that's 4 walls and a door, that only you are in and you can be sure that no one else is going to walk into without knocking on the door or whatever, then yes, you can be in there without a mask on. But otherwise, you need to be wearing a mask when you're at work in an office setting.
And we've gotten questions about this in offices where if it's a shared space, even if nobody else is around and you choose to take off your mask, you're now exposing that space to any droplets you may have. So you're going to have to disinfect the space. So taking off your mask may mean more cleaning if that is also a shared space with other people, even if those employees are not around.
Right. That's a really good point. Yeah.
Oh, I get a lot of questions every week. So we're walking through the rationale of some of these orders. So I have a question. Amber, you said you get a lot of complaints from people about masks. Are these mostly customers? Are they employees? I mean, this affects everybody on these calls if it's customers and employees.
Right. I would say it really is a mix. We have, even employees saying, I don't feel safe because my employer isn't enforcing, other employees to wear masks, and I just feel unsafe at work. But I would say, the majority of what we get are just, I walked into a retail store and over 50% of the people were not wearing a mask. So I think it really just, showcases, if you're not enforcing it, there are going to be people that, they just refuse to wear one. And so that's the challenge. But I think, increasing signage where you can, especially if you put signage also by the shopping cart area, not just on the entry door. And then just if you're having somebody greet people, just asking them, do you have a mask in your car that you can just go put on? Or a lot of stores are just handing them out, like just having that ready as people are coming in. But I would say, the majority are just, a lot of patrons not wearing masks. So that's really why I wanted to focus on, the mask wearing today. So.
And it affects consumer confidence. So if a consumer walks in and for some reason you're not following the mask order, you have a large number of people without masks, there's a lot of people in our community that won't go back to that restaurant, store, facility because there's still a lot of fear of transmission.
Yep.
Yeah, and I think, we are seeing, some of those complaints coming through and just people expressing their concerns on, I'm taking the time to wear my mask to protect you and, just hoping that people will do the same for them.
And when you guys did the survey about masks and we've done some general information, we still have a lot of people that believe that the opening has been too quick, too soon, that they're fearful to go out still. And I think a big point is that Boulder County is an aging population. We have a higher average age, even with the university, than all our surrounding areas. And a lot of those populations are at risk. So we just need to make sure that we understand the area in which we operate, that people actually still think that some of these openings are too quick, especially when they see neighboring counties. Now, some are perfectly comfortable going out knowing, the mask orders are in place. We've also gotten questions from employees who have said, so my employer says, oh, we all know each other, we can take off our masks, and they feel uncomfortable but they do it anyways. As an employer, what's your responsibility in that situation? And Jesse, you can probably talk about this from our previous calls.
Sorry, can you ask the question again?
So there's been employees who have come in and said, my employer, said we're all around and we're like, oh, we all know each other. We can take off our masks. As an employer, what's your responsibility?
Right. Thank you. So yes, as the employer, you are responsible for your employees' behavior. If an outbreak occurs, you're responsible. And if for whatever reason, one employee is not comfortable and everyone says, well, we're all comfortable, and they go along, but then they call us and say, hey, this business is not wearing masks. We're going to hear about that and we're going to come to you. So it's really important to enforce the rules as they're written, but also to explain why they're written the way they are. And that is to protect the community. It's also to protect those people who aren't comfortable saying, hey, I really wish I could wear a mask, we'd all wear masks in this situation, because while yes, at work, you may all be around each other for 8 hours every day, there are other hours in the day where there's people are not around each other and they're breathing the air of other people and bringing in whatever those other people have to your office space. So really be cautious about the behaviors that you allow in your office spaces.
And just to point it out, recent outbreaks in Boulder County, it wasn't the employee's name that was in the news because that's private. It's the company. And then when there's an outbreak, it is put out on the state website, and we've seen local news agencies pick up the names of the businesses where outbreaks have occurred.
Yeah.
So we have a new type of personal services or retail that is on today's call that has a question. So they're a photographer where they're at the studio. It's not easy to always maintain 6-foot distance, but can clients be without masks for portraits? And also, what's the rules about makeup if they want to do more than just eyes for makeup for photography?
So if you can't maintain 6 feet of distance, in that case, I would say that's not a procedure that requires. So I would say the order doesn't specifically say everything can be done without a mask, as long as the employee is wearing a face shield. It's procedures that require removal of the mask. So I think in this case for photography, what they're saying is you need to, if you're going to have them take their mask off, you need to be more than 6 feet away. And whether that's setting up the camera closer and coming up with some sort of tool that allows you to take the photo from a distance, I can't say, but I would, the order is clear that you need to everyone needs to be wearing a mask except for specific procedures that require removal of the mask. In terms of makeup, in that case, I would say during makeup application, as long as the photographer or whoever's doing the makeup application is wearing a mask and a face shield, you can totally do that without a mask or without with the client taking the mask off.
So it's similar to lip piercings or facials. You're going to need to follow those guidelines where there's a face shield and a mask.
Yep. Right.
If there's time off. And it's not about time, the amount
Right.
of time someone has their mask off. It's about they have their mask off, you're within 6 feet of them, there needs to be additional protections.
Exactly.
Okay. But if they have a mask off for a portrait, the photographer needs to be 6 feet away.
Yep.
Or farther. Okay.
I would also say, you know, if they could do outside photography versus indoor, like that would always be better too. If there's option to do outdoor versus indoor. It's just
a really
less
good point.
exposure. Yeah.
Personal services covers it all.
Like, it really does.
It's a lot of industries that we've had on these calls in the past 8 weeks or so. So, are there any other questions out there? This group didn't really have a lot of changes, and there will not be, as we've indicated earlier, probably a lot of changes in some of the key aspects of the order. The employee health checks, sometimes customer health checks, social distancing, masks. There will be a lot of these going into the fall. All right. Seeing as there's no other, we'll give everybody 15 minutes back, including you two. I'll see you on the call in half an hour, but I want to thank everybody for joining us. Oh, one more question came in. See,
Excellent.
This always happens with this group. This group. Can you remind me where the occupancy calculations are?
Yes, I can. Let me go. Okay. I can.
And I'll post it in the
you.
chat too while we're.
I'm going to stop sharing this and I will share my, here. So can everybody see that new graphic? Is that appearing on everyone's screen now?
Mm-hmm. Yes, it is.
Great. So this is the covid19.colorado.gov web page. I'll step back through this just to show you where I went. This is the main page for Safer at Home. And if you go down to social distancing calculator and click on that, it takes you to this graphic, which explains what the social distancing calculator does. And then at the bottom of that page, you click on social distancing calculator, and there appears the social distancing calculator. And it really is as easy as saying, I've got 1,000 square foot space and I've got some counters and things like that, and they take up 20% of my space. And so unfortunately, 6 people in 1,000 square foot space with 20% of that space taken up with other things. And that's, it's that easy, but again, the way to get to it is through the covid19.colorado.gov page, go to Safer at Home, and then the social distancing calculators on that left-hand side of the page.
Great. We got another question that came in, which is about where you find the, on your webpage, where you find the local orders. I did mention that one chart that shows the different orders is on your webpage,
Yep.
but you might actually have to go to the municipality websites to find their orders.
So yes, I don't believe on our, I don't believe on our page it links to each locality's orders, but I wanted to show you. So this is the Boulder County COVID-19 main page, and down here, as you scroll down the page, you can see the Boulder County face covering order is covered here, and our businesses section is down here. You can go in here and see a ton of detail, but I will show you, let's see, as I scroll down here, there's a bunch of, so these are the graphics that Ambra grabbed there and talked about, these face covering requirements for employees and for the public. But yeah, we don't have links to the specific face covering ordinances for each community.
And since I know this person's in, by the way, the person who said they can't hear you very well said you can hear you much better today. So thank you, Jesse, for speaking up. I'm going to put a link to the news site for Lafayette, since I'm pretty sure the person who's asking these questions from Lafayette. And it will talk about, it actually has a list of all the Boulder County face mask orders, but there's also a link to when the city council enacted the face mask order in Lafayette. Same thing on Louisville, Erie. It's all on their websites, and it's usually under their news release section where they'll list the latest orders from there. But on your website, it kind of at least has that chart that shows you if you're in Lafayette, this is what's required. If you're in Erie, this is what's required. All right, I'm gonna wait one more minute to see if there's any other questions. It only is during the personal services call. So, but this chart really, it's been kept up to date as far as, you know, to help you navigate. The strictest order goes forth. So if Louisville has a stricter order than Boulder County, you're gonna have to follow that one, which is why this is set up the way it is.
Right.
All right, I don't see any more questions. I want to thank everybody for attending and asking these questions. This is very important as we raise consumer and employee confidence, continue to open our businesses in a safe manner, that we don't go backwards, and that we can move our community to that next phase of protect our neighbors, whatever it means, as we were learning. We do have these calls. We will have this call next week, and then it may change as far as what the timing or the grouping is, but we will continue to have calls and offer opportunities for you to ask your questions, provide your feedback, and get information. We will see everybody next week, and you'll get an email from me in the next day or two with all the links that were mentioned today. Thank you, guys.
Thank you.
Thanks.
Have a good day.